Hello, everyone. I'm so glad you could join us. Welcome to today's Research America Alliance member webinar. Before we get started, I want to direct your attention to the screen for instructions to mute and unmute your lines. And please type your questions into the question box at any time, and we'll save questions for the end. For those of you dialing in by phone, we will open up the phone lines after the presentation, and you can hit *6 to unmute your line to ask a question. I'm delighted to welcome our speaker today, Dr. Louis Sullivan, Chairman of the Sullivan Alliance to Transform the Health Professions. Dr. Sullivan, as you know, served as U.S. Secretary of Health and Human Services from 1989 to 1993 under President George H.W. Bush. In 1990, during that time, Dr. Sullivan established the Office of Minority Programs at NIH, which later became the National Institute on Minority Health and Health Disparities in 2010. Dr. Sullivan was also the founding president of Morehouse School of Medicine and served as president for more than 2 decades until his retirement in 2002. Dr. Sullivan, Lou, my friend, it's so terrific of you to join us today. And we know that you recently wrote a very powerful piece that touched on some of the issues you're going to talk about. We look forward to hearing from you. Over to you, Dr. Louis Sullivan.
Well, Mary, thank you very much. And let me send my regards to all of the participants in today's webinar. I want to really talk about our health system and how the coronavirus pandemic has really exposed weaknesses and deficiencies in our system. But I want to first talk about some of the strengths in our system and point out, from my perspective, the deficiencies that we must address and we can address, and what I would anticipate the improvements would be from doing so. So let me begin. Throughout the course of the 20th century, we improved our health system in many ways. First, we improved our health professions education system, beginning with the Flexner Report in 1910. The result of that report, which was very critical of medical education in the country, the result of that was to strengthen the science base in our nation's health profession schools. As a result of that report, by the middle of the century, medical education in the United States was the leader in the world. We had and continue to have people from other countries coming to the US for training that is often not available in their countries. So that's one result of the strong science base which we have developed. Secondly, with advisors such as Vannevar Bush and advocates such as Mary Lasker, we developed a strong biomedical research enterprise headed by the National Institutes of Health. The result of our investment in biomedical research, which is now north of $30 billion annually, this has resulted in the strength of our investigations, so the more Nobel Prizes in medicine and physiology have come to scientists in American laboratories throughout the course of the 20th century than in the rest of the world combined. We've advanced our medical technology system so that we now have the capability of replacing joints. We have kidney dialysis, we have cardiovascular catheterizations, stents, etc. All of these have resulted in improvements in healthcare. Because of all of these advances, we could say life expectancy for Americans throughout the course of the 20th century improved significantly. In 1900, it was less than 47 years. Today, average life expectancy for Americans is just north of 80 years, and they are useful years of productive life. So we have much to be proud of and much that we can point to as a result of what we have invested in our biomedical science enterprise, as well as in our sciences in general. But in spite of those advances, we've had some failures. We have not been successful in developing a system of healthcare that makes healthcare easily available and affordable for all of our citizens. We have engaged as a country in an ongoing debate throughout the course of the 20th century as to who is responsible for providing health care. Is it the individual or is it society? Is it government or the private sector? From my perspective as a health professional, I think this is less important as to who provides it than to be sure that it is provided. The reasons for that are as follows. We need to have healthy, productive citizens. If we have individuals who are healthy, they can be productive, they can work, earn wages, supporting themselves and their families and their children, as well as supporting our society through the taxes that they pay. So we need to find ways to provide that health care in a way that gets us beyond the interminable political debates that have been ongoing and that continue to bother us today. In our public health system, we've had some successes as follows. The CDC was developed to eliminate malaria from the southern part of the United States and has been successful in that and in many other conditions. We have eliminated smallpox from the world. We have almost eliminated polio from the world. It's been eliminated from the Western Hemisphere. We have developed other vaccines that have improved the health of our citizens. So there are these examples and many others that we could point to that result from the investments that we have made in our science. In my own career, I have witnessed the success that we have had in combating the AIDS virus. When I became Secretary of Health and Human Services in 1989, we had activist groups that really had lost faith in our scientific enterprise. Active groups were marching around the country, feeling that their concerns had not been sufficiently addressed. In October of 1989, I, as Secretary, was able to approve federal reimbursement for AZT, a drug, the first drug that was found to be effective against this virus. Interestingly enough, AZT, or azithromycin, was a drug that had been developed by the Wellcome Research Laboratories in their effort to find drugs active against cancer back in the 60s. This drug, AZT, was not particularly effective, so it was put on the shelf. But when the AIDS virus appeared in the 1980s, this drug, or among others that were tested, was found to be effective. So with our approval for reimbursement for use of this drug in 1989 and measures taken by President George Bush of putting in his budget proposal to the Congress in April of 1989, more than $4 billion to be used for AIDS research, education, prevention, and therapy. That was the first of a number of appropriations that were made against AIDS. As a result of that, we can say that today we have more than 30 drugs that are effective against HIV. And rather than the diagnosis of HIV infection being almost a death sentence, which it amounted to in 1989 prior to use of AZT, people with this virus are now living 10, 15, 20 years, raising their families, working productively, earning wages, paying taxes, and we still are hoping for a cure for HIV infection. But while we still await a cure, this infection has been controlled by the drugs that have been developed by our scientists with their investigations from US laboratories as well as laboratories from elsewhere around the world. Today, the coronavirus represents a challenge to us. Clearly, this is a highly infectious, dangerous condition, but already we are seeing signs of hope, signs of the number of candidates for development of a vaccine, other candidates for an antiviral pharmaceutical agent have come forward. Our Public Health Service has recommended a number of things such as social distancing, we've developed diagnostic tests to detect this virus. We've developed techniques to find antibodies so that we can detect whether or not an individual has been infected in the past for this. So we have a major challenge from our coronavirus pandemic. And this pandemic has also shown the fact that for African Americans, Latinos, and others who are poor, they're disproportionately affected by this virus. So this has been shown around the country in various states where the number of people who are infected by this who are African American, the percentage who are infected are higher among African Americans and Latinos and the poor. The death rate is also higher. And why is that? It is because this virus seeks out those who have pre-existing conditions such as heart disease, obesity, asthma, and other conditions, so that they are more susceptible to this virus and therefore they succumb to it to a much greater degree. But it also affects the people who are lower income, who don't have the ability to do what you and I on this webinar are doing, where we are working from a sequestered area where we're safe. But people in the service industry, such as waiters, grocery workers, and others, really are out in the public to a much greater degree. Their jobs are not ones that can be done from a distance as we are doing today. Therefore, they are more exposed and they're more vulnerable. So we have to address that. We also know that within our society, low-income individuals and certainly our minority populations are more have a greater level of distrust of the health system due to unfortunate things such as the Tuskegee syphilis study, which ran from 1932 to 1972 in Alabama, where African-American men thought they were being treated for syphilis, whereas they were not receiving therapy, but the natural history of this disease was being followed. That has resulted in an ongoing level of mistrust among a number of people in our society. And that is something that we as health professionals have to work to regain that trust. So what we have today with the coronavirus infection is a health system that has a strong science base, but I say in spite of the strong investment we have made in biomedical research, the investments we've made in increasing the number of health professionals, whereas in 1950, we had 80 medical schools in the country, graduating some 8,000 physicians every year. In the second half of the 20th century, we added 47 more medical schools, so that by 1981, we were graduating 16,000 physicians annually from 127 medical schools. And now we have closer to 150 medical schools, and we're graduating more than 20,000 physicians every year. And we have other kinds of health professionals that did not exist decades ago. Nurse practitioners, physician's assistants, and many others. So we have a plethora of health professionals that we have to mobilize effectively against conditions such as the coronavirus infection. So what we must do is show the public in general the advantages in investments in science, because the life expectancy has increased, as I mentioned, from less than 47 years in 1900 to more than 80 years today, from a strong science base, improvements in our medical technology, development of new therapies, and this has resulted in a healthier population. The promise of our science today is equally exciting as it was 20, 30, 40 years ago, because we know that we will develop therapies against this coronavirus infection. And the results of that not only will be improved health, but also a more productive citizenry. But in order for us to achieve that, we have to develop a greater understanding of science and biomedical sciences in our population so that they recognize and are willing to support the investments that result in better health and a more productive, active population. This is not, from my perspective, a question of investing in a health system versus other investments. We need to have a healthy economy. The United States is a prosperous nation because of the investments we've made in the sciences in general, including the biomedical sciences. We have to continue that. But in order to do that, our public must understand and appreciate the return on investments that they get from that investment. So a healthy nation requires a healthy population as well as a healthy economy. It is not one versus the other. It is both. Investments in a healthy economy that our financial leadership and our advisors help us with, and advances in our biomedical sciences for our nation, including affordable, accessible health care and a stronger public health system. In the op-ed piece I wrote for the Atlanta Journal-Constitution a few Sundays ago, I pointed out that we have not supported our public health system to the degree that we should. Both our national public health system as well as our state health systems, and also for our tribal lands for Native Americans and areas such as Puerto Rico and other islands that are part of the United States. The investments in strengthening our public health system will make sure that we will be better prepared when the next new virus comes along or the next public health emergency. We need to have a system that is able to detect, anticipate, and respond to the threats that will come down the chute a few years or so from now. That investment will be repaid by a healthier society and a healthy population. What we have to do, in my view, is show our American citizens that the investments in science and including the health sciences results in improved health conditions, improved health status, increased productivity from our citizens, and therefore the return on investments makes for a stronger economy. That is a challenge that will take time for us to have our citizens understand and respond to, but we're the ones who really have to do that. So we have to do that, and we also have to work to gain the trust of our citizens that we are acting in their interests, that we now have a system of ethical safeguards so that things such as Tuskegee won't occur anymore. We have a strong system of ethical principles and oversight that will avoid that. So that is the challenge that we have for us. That is something that we should take advantage of, this increased awareness of our society of the dangers that we have if we do not invest in our health system. But by making those investments, we will be better prepared and we should do better in the future. And with that, I will stop and I will welcome your questions and comments and suggestions, because I've laid out what we have to do. The solution to that, a number of things that we must do to really increase the understanding and support for science, including the health sciences, in our society. So thank you very much for listening.
Oh, thank you, Dr. Sullivan. That was just superb, so welcome. I wonder if we can get you back in public service. Is there any chance? Your leadership has been so extraordinary over the decades, and recounting your experience around HIV/AIDS at another extremely fraught time for this nation, I think was a good reminder for us all of how science can prevail. It will prevail given every opportunity, including resources. But your point there, too, about how activists had lost confidence, and it was an opportunity moment that you and President Bush stepped up on, really did step up. So I was reminded of that. I thank you for your leadership then and now. I have a quick question, and then we'll see if others have come in. You stressed the importance of gaining understanding and trust by the broader public. Do you believe that that's something that everybody in the health and science professions can play a role in, or should it be left to organizations?
No.
The role for individuals.
Yes, I believe that this is both. It's organizations and individuals, because what we need to do is increase the level of understanding and knowledge about science. And I'll give you another example. One of the things I'm proud of was the ability to recommend the appointment of Dr. Bernadine Healy as director of the National Institutes of Health, the first woman, and still the only woman, to serve as the director of that institute. At the time, we thought that the number of women's conditions were really not very important, but under the leadership of Dr. Healy, we developed a women's health research program at NIH that was headed by Dr. Vivian Penn, who distinguished herself over many years with that. We now know a lot more about heart disease among women, about detection of breast cancer and other conditions. So we have, and we are enjoying and benefiting from the contributions that women are making and the increasing number of leadership positions that we have. I also had the ability to initiate the Office for Research in Minority Health, as you alluded to. And we now have an institute that is looking at minority health issues. And I think the COVID virus pandemic has shown in dramatic ways the fact that our minority populations are often disadvantaged in terms of their health status and access to health care. And we have to find ways to address that, which means not only developing the systems, but also getting our minority citizens themselves aware of the things that they can do and should do and must do in order to become healthier individuals. So we have to increase the level of understanding and support, and that is, in my view, a responsibility for various health organizations, whether it's the American Medical Association or the National Medical Association or the College of Physicians, health nursing professionals, etc. And it has to become understood to be a value that is worth investing in. We have to have people understand investing in health is an investment in a better future, and therefore the return on that investment is worth it, and we'll be better off, a healthier society for that. So it's a responsibility that all of us have, and we have to develop a better understanding in our culture about this. That's the challenge that we have. But as health professionals and those of us with health organizations, I think we should play a leading role in that effort.
That's great. Just a real call to action for all of us. Terry, do you have a question or two for Dr. Sullivan in these last few minutes?
Sure thing. Thank you so much, Dr. Sullivan. I have a question here that the questioner applauds what you say about improving our public health system and is deeply worried about attacks on civil servants and those who are now in the civil service. How can we message better the importance of public health as a right and how we all benefit from a healthy population?
Well, I think the thing that we can do is to point to the victories that we've had from our public health system. A good example is the elimination of smallpox, a disease with a high fatality rate. We've been able to eliminate that from the world because of public health measures. Poliomyelitis is close behind. We've almost eliminated polio from the world. I was a medical student in the mid-50s, and I took care of patients with paralytic polio. The Salk vaccine came along in the mid-50s, and the following year after that vaccine was introduced, the number of people with paralytic polio almost vanished. That's another victory. And there are many of those. The AIDS epidemic that we had in the 80s, that is a more recent example of the improvements. We now understand the human genome so that we now have the ability with the developing science
Hello. We seem to have frozen Dr. Sullivan's screen right now. If you who are listening to the call can hear me, I want to thank you. We're almost at the conclusion of our time. So I want to thank you for joining us and also encourage you, thanking Dr. Sullivan, of course, and also encourage you to join in on our next Alliance member call, which will be next Friday, May 22nd at 1 p.m. Eastern, when we will be hearing from Dr. Victor Zhao, President of the National Academy of Medicine. Please keep an eye out for the invitation email with the registration links. Thank you again, and please stay in touch. Bye now.